The first one is, I think, for the students. They really feel like they have an advocate that's outside of the program. We don't employ the therapist, they're not employed by us. And so the student feels like there's somebody who's outside of the program that they can really go to and share what's going on with them and what they need. So right from the beginning, the process is very different for our students. They come in the door, they get to meet or interview maybe 2-3 different therapists and really decide who they feel like they resonate best with. We want our students to be able to really drive the agenda of therapy more, that they bring stuff to the table and they direct what they want to work on in the process of therapy. And outpatient therapy is very different than inpatient residential therapy. And so we wanted our students here to have the opportunity to really practice what that process is and to get the most out of it. Our therapists that we work with, the level of expertise and knowledge that they have is unprecedented. We can go out in the community and find the best that this area offers. Our therapists have years and years of experience in this field of working with teens with special needs. Some of our therapists have 15, 20 plus years of experience, and they have a background in a myriad of different subjects: DBT, trauma, sexual abuse, substance abuse, depression, anxiety. So the quality is so fantastic. At Mountain Springs, the advisor gets to fill a lot of those different roles as far as updating parents, managing consequences and privileges, helping them get a job, different things like that. And then the therapist gets to just focus on individual and family therapy. Along those lines, often with that collaboration between the advisor and the therapist, we want the student to really be invested in that process as well. If there's an issue that's going on campus, we expect the student to go to their therapist and talk to them about that, but we're following it up with an email or a text from the advisor to make sure that happens. And additionally, the other way around, if there's something that the student is sharing in therapy that the therapist feels like the school should know about, then they're encouraging the student to own that process and take accountability. Lastly, because the therapy is separated from the school at Mountain Springs, a large part of what is talked about in therapy is confidential for the student. Of course, we do share pertinent information back and forth as needed, but most of what is talked about in therapy will be confidential for the student. This allows a safe space for the student to really feel like they can open up and share and get deep in a really important way in the therapy process.